My name is Dr Thoraiya Kanafani. I'm a clinical psychologist and clinical director at the Human Relations Institute and clinics here in Dubai. So I think the most important thing the most important difference between what people think therapy is and what it actually is that we don't give advice. And a lot of individuals feel like when they come to therapy, they're coming to get fixed and they're coming to get advice and somebody's going to tell them what to do and then they can leave. Actually, that's not what happens. So in therapy, you are guided to find your own answers and you are guided to figure out your own way and what's best for you. So that's in terms of what therapy actually is. In terms of the benefits that you get from therapy is really that it's a self-awareness and a self-understanding of where you need to go, and not just where you need to go, but where you've started. So why is it that you think and feel and behave the way that you do? Where does that come from? Why are you still engaging in that behavior or thought pattern now? And then learning how to adjust that and move forward. And really accepting so many things about yourself that maybe without somebody like a psychologist, it would be hard to do. Not impossible, but just difficult. Also, it's a little bit to take away from this idea of talking to a therapist is like talking to a friend, because it's really not, because therapists provide a very non-judgmental, safe space for an individual to share things, anything, without any kind of repercussion or judgment or any kind of negative worldview. I think a lot of the reasons why people might feel reluctant to seek therapy is because they don't really understand what therapy is just yet, and not many people talk about it. So we talk about the idea of mental health, but we're not really discussing what therapy is. So people become reluctant because they think they might feel weak if they seek help. If they might feel like, oh, you know, if I go for a therapist, she might think I'm crazy, or he might think I'm crazy. So there's a lot of fear that comes into play when we talk about people feeling reluctant to go in for therapy. Well, I definitely see consistently that students tend to smoke quite a bit, be it cigarettes or vaping or anything like that, in order to cope with mental health difficulties. So when it comes to social norms and traditional mindsets of not seeking therapy, I think, you know, it's kind of understandable where that comes from because of the previous mindsets and generational gaps that we have from how people used to think before. But right now, obviously, we are in a much better place. We have a lot more awareness than we ever did before. We have a lot more scientific evidence that shows the importance of mental health. So I think it's very important to start letting go of all those traditional values that we used to have when it comes to mental health in specific, because things or the idea of getting over things is not as realistic as it used to be before. So I think when it comes to finances, definitely it can be an issue with students because obviously they may not necessarily be able to afford therapy. So I would suggest try to find somebody that does either reduced amounts for students or free sessions here and there. Talk to your school counselor, because that makes a big difference, because the university does have a psychologist on board as well. When it comes to your parents trying to convince them, I think it's important for you to have an open communication with them and really try your best to not convince them, but educate them, because it's not their fault that they don't know. And I think it's important to try to get them on board. If that's really not possible, then try your best to seek help from somebody who knows either a reduced price or a free service.